Hi everyone, I'm doing my PowerPoint on case-based learning and applying and analyzing social work competencies. My name is Victoria Sho, and I'm excited to get into it. Just for a simple introduction, the purpose of this PowerPoint and presentation is to apply social work competencies to 3 case studies and use analysis to learn from them. My 3 focus areas for the case studies are professional and ethical behavior, human rights and justice, and diversity, equity, and inclusion. We're going to move along to case study 1. The overview is the client is a 16-year-old named Alex who has depression and suicidal ideation. There are 3 ethical dilemmas that I focused on that included confidentiality versus safety, duty to protect / duty to warn, and minor status and parental involvement. For the first ethical issue of confidentiality versus safety, I used the MSW standard 1.07, privacy and confidentiality, to look at this. As social workers, we must safeguard clients' privacy and confidential information. Disclosing only with informed consent or when legally mandated is important. For example, if there's an imminent or immediate danger of harm to self or others by a client, that is something that we have to make sure we inform someone about. However, breaching confidentiality without a legitimate exception can compromise the trust you have with your client and can damage the therapeutic relationship you have with them. For duty to protect and duty to warn, social workers have an ethical responsibility to prevent foreseeable harm, and sometimes this can outweigh confidentiality. If one does not share about potential harm, it could lead to a risk of self-harm, and you could possibly have liability for not following duty of care if someone found out that you didn't say anything, or if they do hurt themselves and tell somebody that they had told you. When it comes to minor status and parental environment, depending on the state, parents and guardians have a legal responsibility for the child's welfare. And some parents may be unaware of full issues going on with their minors, so sometimes you need to inform them about what's going on. My proposed strategy has a couple of parts. For one, you should conduct a risk assessment with Alex, the client, because you need to determine the level of risk, whether it be present immediate danger, or a concerning risk but not immediately imminent, and you should act according to those. And number 2, you should have a collaborative approach, and that includes discussing concerns with Alex, involving him in the decision to tell his parents, and making sure he understands what the plan is going forward. And this can promote empowerment and dignity to Alex and let him know that he shouldn't be shamed for what he's going through. Then you could explore less intrusive options, which include creating a collaborative safety plan and having or using school support systems. For number 4, you need to involve parents pragmatically and give them the concrete behavioral steps that they need to watch out for or what they should not allow. And you should let them know about the steps for urgent evaluation when it comes to him, whether that be going to a doctor or whether that be seeking further professional help. And you need to give them a clear plan for what may come next. Number 5, you need to consult and document. Consulting supervisors and possibly an available risk manager can help you get a different perspective and a better understanding. And of course, document. even very little things to his name, his age, and stuff are very important when it comes to being a social worker and helping people. For case study 2, the overview is it's a low-income rural community with approximately 5,000 residents, not radiants. So actually that's about the size of the hometown I grew up in. So I was able to look at this with kind of thinking about my community that I grew up in. The systemic barriers that affect healthcare, education, housing, and economic opportunity are very important to be looked at and assessed in this case. The challenges in this community stem from interconnected systemic inequities, and they were be able to receive a grant funding of $2,500,000. When you evaluate the systemic barriers, we have to look at the root causes of this. One is institutional and structural racism, which if you have long-standing racialized policies, these can lead to disparities and differences in the quality of the housing, available school resources, and healthcare access. And these systems can reproduce to poverty and restrict mobility. For instance, if you apply this case study to a very rural community or town, many of them don't have access to a hospital unless it's 30 minutes to an hour or even more away. The second root cause is economic disinvestment. Rural areas often suffer from limited job opportunities, underfunded infrastructure, etc. That's why some towns look run down, because they don't have the money to fix things. This often results in reduced tax bases, undercut education, healthcare, and housing quality. The third root cause I discussed was policy barriers and governance gaps. And local government policies often favor private interests or companies or property owners over low-income tenants, which can limit the affordability of housing and proper investment. Bureaucratic funding restrictions can prevent nonprofits from tailoring programs to community needs, as I saw in a paper by Benton and Dion. Then the fourth root cause is healthcare and education inequities. Rural residents' lack of insurance and providers, like I mentioned earlier, can contribute to untreated illnesses, mental health crises, and preventable mortality. Similarly, underfunded rural schools can contribute to low graduation rates, leading to undereducated people that may want to get better education, but they don't have the access to it. My proposed strategies for change include community-driven initiatives, which you can involve residents in planning on how to distribute the grant money, and you could also establish a community advisory board. It also includes advocacy, which includes pushing local government to address inequitable policies, and you can use community voices, support, and research on how better policies can help in the long run. You can also collaborate with local organizations, healthcare agencies, schools, and housing entities to create better initiatives for the community. As far as the promotion of human rights and social justice related to this case study, it's also important to remember as social workers, we should challenge social injustice, as the ethical principle from the National Association of Social Workers states. We also should empower marginalized communities to participate fully in decisions that affect their lives. And as the United Nations said, we should also advance equity and access to housing, health, and education. All of these are core components of the human right to adequate standard of living, and we should all have access to those. For case study 3, we're looking at a nonprofit staff that raises concerns about inequities, And the issues related to this case include biased hiring, lack of leadership, diversity, weak cultural competence, etc. And staff from marginalized groups feel unsupported. At first, I want to look at accessing current practices from this. The first one is biased hiring and leadership representation. When leadership and management are not reflective of the populations they serve, it perpetuates what's called a representation gap, which means there's a gap between the actual population and then the people that are supposed to serve that. This can undermine trust, limit culturally informed decision making, and reinforce systemic inequalities. There's an impact on staff because of this. Employees from marginalized groups may experience feelings of exclusion from decision making, limited career advancement opportunism, and feelings of duplicity. And there's also an effect on the clients. Clients may perceive services as culturally biased or disconnected, which can cause them to reduce engagement and satisfaction and may lead them to going to a different company. The second thing I looked at was limited cultural competence in service delivery. When you don't have the right level of cultural competency, it can suggest that the current training or program may not be sufficient to address the diverse needs of clients. This can lead to mismatches in service. The impact on staff with this concept is workers may feel ill prepared to serve diverse clients effectively. And as far as the impact on clients, cultural misunderstandings or cultural sensitivity can discourage clients from seeking help and reinforce systemic distrust. Another thing I looked at was the inequitable professional development. Staff from Hispanic, Latino, or Latino, and Native American backgrounds report unequal support and advancement. These may stem from bias in performance evaluation and lack of mentorship pathways for people from marginalized groups. The impact on staff includes higher turnover, reduced morale, and diminished trust in the leadership. And on the organization itself, they can lose talent and their reputation can be harmed as being an equal and equitable employer. For design interventions, I would say revise hiring and promotion practices to ensure equity and transparency, redesign job descriptions to remove biased language and ensure that diverse hiring panels become a standard practice for your company or organization. Third, I would say develop and implement ongoing and mandatory cultural competency and anti-racism training. This can enhance staff self-awareness, empathy, and responsiveness to diverse client needs. I would also say create mentorship and sponsorship programs for staff from marginalized groups. This can build advancement pathways for marginalized groups and offer them like they have a self-sense or have a sense of belonging. And you can also establish accountability measures, which includes annual reporting and DEI metrics. The long-term goal from all of this is to create and foster an inclusive and equitable environment for both staff and clients. And you may be thinking, how does this help us as social workers? Applying ethics, human rights, justice, and DEI does more than check regulatory boxes. It can make social work more client-centered, responsive, and effective. It can enable enough your practice that prevents harm of various kinds, whether it be ethical, cultural, or systemic. It can also strengthen the professional identity, integrity, and accountability of the worker or workers. And it can also help social work have more profound, sustainable impact, not only at the individual or micro level, but also in the meso and macro systems. And for my citations, I actually had a lot because I looked outside of our required readings and was able to find some pretty good sources. And I just want to thank you for watching my presentation, and if you have any questions, don't hesitate to reach out to me. I included my phone number in my email. Thank you.